It was an epidemic that caught health officials off guard. In 2003, SARS, a previously unknown respiratory illness, spread to Canada. Nowhere were the effects felt more acutely than in the city of Toronto. SARS was not detected quickly enough, nor was the public health response adequate. Now, 10 years later, is Canada prepared for a similar outbreak? Christina Stevens reports.
A decade later, the memory is still raw for nurse Susan Sorrenti.
Panic immediately, concerned about my family.
Days after exposure to a SARS patient in Mount Sinai Hospital, a sudden spike in her temperature indicated the worst. She too had fallen ill with the mysterious disease.
What was going through my mind was, where's my life insurance policy? I have to get things in order.
They were terrifying times. So little was known about SARS, but what was clear, it was deadly and highly contagious. By the time it had run its course in Ontario, 44 people had died and 330 more had contracted the respiratory illness. 45% of the cases were healthcare workers. Experts say it didn't have to get so bad.
It was very frustrating to see the disarray and relatively poor level of infection control.
Since then, there have been 3 scathing reports on the handling of SARS. One called it a system failure, saying the surprise is not that Ontario's response to SARS worked so badly, but that it worked at all.
The system lacked worker safety resources and expertise.
The province has since said it's made good strides in applying lessons learned. But Dr. William BOWIE isn't sure we're ready for another infectious outbreak on the federal level, where he says there have been cutbacks in public health.
If you combine staff being decimated and the reluctance of politicians to listen to scientific advice, then I'm not super optimistic.
Sorrenti says she's hopeful the system is better prepared.
It was a real wake-up call for us to, really take these things seriously.
One of the reports called the nurses and doctors on the front line of SARS heroes, something Sorrenti shrugs off, saying she was just doing her job. Christina Stevens, Global News, Toronto.